I am very excited today to introduce our communications session. And we're going to start out here with Dr. Courtney Howard, who is going to be speaking remotely. Courtney is just totally fascinating, incredible. She is an ER doc from Yellowknife, Canada. She is very politically active, very active in the climate and health space in Canada. And she just completed a master's degree in public policy at Oxford this past year. And she's a mom, and she's super wonderful and a great speaker. So here's Courtney, and we are going to have a great session here now. Thanks, Courtney.
What a wonderful introduction. It's nice when a friend introduces you, someone you actually know. That's lovely. Well, I sure wish I could be there with you. I am not, because I'm at a Canadian Medical Association board meeting, because we need more money in climate and health, and influencing people with money and participating in conversations is one way to do that. So I'm very sorry. And this is sometimes just what happens. So what we're going to do right now in preparation for some of the other incredible presenters is just to go through a paper that Jenny Miller of the Global Climate and Health Alliance, Ed Maibach, many incredible people, Jody Sherman, who may be there, contributed to, that's meant to be an introduction to people for work on the climate and health emergency. Probably many of you, like me, you came to this and, did a giant literature review, learned a ton of material, and then we're like pretty depressed. And then we're like, well, what do I do now? And I've been at this for 13, 14 years now, because I live in a subarctic region that you see here, and we're melting. So I didn't know anything about climate change and health. And I've essentially learned by trial and error from a lot of environmental campaigners, from communications people like Ed, and now finally through formal study of public policy and movement building, how to move from that, wow, this is a really big problem, to how can I communicate this in a way that doesn't totally depress people and that motivates them to action. So we actually designed this whole paper to have a set of action items for people, but in fact, the entire way the paper is written, and particularly the graphics associated with it, are designed to take people through it in as effective, time efficient, and also compassionate a way as possible. And you can download the paper and the slides. So hoping to reduce barriers for people who are coming to this, because it actually takes a long time to put a presentation like this together. The slides are all downloadable. And what I'm going to do right now is take you through how I'm suggesting they could be personalized, so that you can, if you have emerging advocates and they don't have time to put a slide deck together, or you want to kind of point them in the right direction, we can invite them to do that. So this, what you see behind this text right now, is how I would suggest starting your presentation. So this becomes part of what Marshall Gans talks about as the story of self. Why do you care about this work? So when this slide comes up, and I start many presentations with it, I talk about how I was a young doc. I was coming north for the first time. I wanted to work for Doctors Without Borders, and I happened to pick up a book on climate change on my way through the Edmonton airport, and I read it on my way up to Inuvik, which is north of the Arctic Circle, and got really worried and sat down in the hospital almost right after I got off the plane, and happened to pull up the Lancet Commission's first report on climate change and health, which says that climate change is the biggest health threat of the 21st century. So I read that, and I looked up, and I looked at one of the nurses. I said, did you know that climate change is the biggest health threat of the 21st century? And she said, no, but doesn't surprise me, because my cousin Ed went through the ice last week. Sorry, Ed, I can't remember what the guy's cousin's name actually was. Went through the ice last week. We're seeing more drownings. It's getting much more difficult to hunt and to fish. We're having food security challenges, and the whole thing is making us very sad. And so after that, I actually went down to a conference and joined the board of the Canadian Association of Physicians for the Environment. And that was sort of how I started. So there's evidence that people trust what you say more if they kind of understand where you're coming from as a messenger. And if you don't give people that story, they're kind of unconsciously filling in the gaps themselves, and it's unlikely to be correct. And particularly if it's not a super sympathetic audience, it may be uncharitable. Like maybe they think I'm getting paid for something. Maybe they don't understand that advocacy is part of a physician's role. So really filling that in right off the bat with a human story, and it helps to have a picture that's evocative of the moment for you. So this is the paper that we're going to be talking about. So this concept of social tipping interventions. So we know that we're in danger of tipping the wrong way within the Earth system, but yet we also know that as trusted messengers, our words really matter. So as trusted messengers, part of a community health sector that allocates 10% of global world product, we actually have the ability to both build concrete structures in terms of decarbonized, resilient healthcare structures that become symbols of the place we need to go. And at the same time, we have the ability to influence policy and totally change the political narrative so we can influence market forces in terms of tipping points towards clean tech. We can influence the narrative towards real public consensus that we need to act on climate change in service of health. And so that is the power we bring to this when we act in a coordinated way. So that's what this paper talks people through. And I've been using it as something I can give to, for instance, the Association of Faculties of Medicine of Canada as they're onboarding deans from across the country. Like, if you've never heard about this before, read this. I'm hoping it's going to be your briefing. And actually, we've had very good feedback on it. So you can download this slide deck here at Dr. Courtney Howard. Is under research and policy. And then you can just import them into a presentation. And so starting off with the story of self. So just as I said, so get a slide, be able to tell a story in a way that people can picture it like a scene from a movie. And this takes practice. So this is actually a good exercise to go through during advocacy training, telling it back and forth in groups of 3, because people will tend to go into a long sort of biography. That's not what we're looking for. We're looking for an aha moment and a picture that is evocative of that aha moment. And so now we're going into the slides about impact. Now, when I first started doing presentations on this, I used to do about 90% impact, and I would look out and people looked like they wanted to jump off a bridge. So I actually started baking cookies. So there was about a year and a half, around about 2011, where I literally baked double chocolate cookies for every single presentation I went to. And right when everybody looked like they were super depressed, I'd be like, "Hey, double chocolate cookies," and I hand out the cookies. And then my audiences started getting quite big. And I thought, well, I can't keep making cookies. And I realized that if I ratcheted back the impact to a lesser percentage of the presentation and spent more time talking about the opportunities, I didn't need cookies anymore. And so that's what we're aiming to do. So when you're putting your deck together, think about your audience. What do they care about? What have they experienced? So this works with a planetary health nest structure. So it goes through item by item elements of the ecological foundations of health that are changing. And then if I'm doing this in a presentation at home, I'll say, well, look at how low the water levels are. This is my dock. My kids were jumping into the water off of this dock last year. And this is actually how low the water levels are now in Yellowknife. And of course, it's not that surprising, therefore, that we had just this terrible, terrible extreme summer. So putting in any pictures that are relevant to what you want to talk about here. And then we start to go in this slide into the health impact. So super simple. You see, we're keeping it really simple. People have a finite psychological window of health with which they can deal with this information. So you want to get right to the point. You want to do it quickly and you want to do it compassionately. So we made these slides purposefully simple, and you can elaborate as you want to. So I often talk about wildfires, and I will often add in pictures that correspond to each one of those different elements that are relevant to the audience I'm speaking to. So here, just as an example, I'll go into the study that we did into the summer of 2014, the summer of smoke in Yellowknife, where we had a full doubling of emergency department visits for asthma. And then we did a narrative study as well, where we asked 30 community members what it felt like to live through that summer of smoke. And there were very many comments around, well, if it's this bad now, what does this mean for our kids? People said things like, oh man, I really felt disconnected from the land. I couldn't go berry picking. I couldn't go fishing the way I usually could. And there was another theme around resilience, where the people who had prepared the most felt the best, who had fire smarted their homes, who knew their escape plan. They stood up very straight, they looked proud. And so we could see that preparation not only does good, but feels good. So incorporate, if you've just had a heat event, if you've just had a flood, whatever it is that your audience cares about, incorporate it in here. This was this summer, it was terrible We had to evacuate our 100-bed hospital. We're 2,000 kilometers north of the nearest referral center. So this is the military evacuating our hospital. And the air quality was terrible afterwards. You can see PM 2.5 of 598 on my deck. That was in September. It still smells like smoke. When I left to come to Calgary a couple of days ago, it still smells like smoke. So think about what your audience cares about, what they're going to connect to, and add in those local events as you're going through this slide. And now, so the slide deck, as you can download it, each one of these things shows up individually, but you don't have to do it in that detail. So you can just add the layers as they come in. So talking about how the changes in the ecological determinants of health lead to stressors on social and structural determinants of health, reduced equity, threats to livelihood, et cetera. And because healthcare provision depends on stability in the foundational layers in terms of all of the determinants of health and an intact supply chain, talking about impacts on healthcare. So you can spend more or less time in any one of these elements, depending on what you want to talk about. And at this point, particularly for new audiences, people are going to be looking sad. And when you think about it, they're in fight or flight. And for the most part, they can't really think once they get to that point. So there's really no point in continuing. If you look, like, get people to turn on their Zoom screens, look out at your audience. As a doc, I'm lucky, I'm trained in how to do a mental status exam. So I'm continuously doing a mental status exam on my audience members' faces as I'm going. And I use that to figure out, okay, when do I need to stop? When do I need to make a joke? And I always now go about 30% problem, 10% of the time I spend talking, acknowledging the feelings that have come up for people. So I have an eco-anxiety dance video that I produced a couple of years ago that I'll often play at this point that takes people through evidence-based ways of coping with ecological grief. A friend of mine, Dr. Hussein Malow in Ottawa, will actually do a Slido, and he'll get people to give the words and make a word cloud in real time of how people are feeling. So what that does is it normalizes those feelings of distress, and it creates community really quickly because people can see they're not alone, and the people they're not alone with are the people already in the presentation with them. So once you've done that, you can move on in a way where people are feeling, okay, I'm normal. Feeling distressed is totally part of this. And now we're going to try to solve this together. And so now we go into the health co-benefit slides. I've presented this now quite a few times, and people love these. So if you're going to borrow one slide from this presentation, people love this. We presented to Parliament Hill a couple of months ago, and the MPs liked it so much here in Canada that they got us to take a picture in front of this. So I've got a cross. All parties had a representative there. So we have a picture of all of these MPs from all parties with this behind us, because this is the hopeful part, right? And this is the place where we can bring in policy measures that decrease health problems right now, save lives, et cetera. And so going through this slide took a tremendously long time to put together. It's been peer reviewed by at least 10 people, much of the Lancet Countdown team, et cetera. So please use it, please use it. So going through this, what I would do is talking about, so what do I actually want my audience in front of me to do? Do I want them to work on active transport? If so, I'll insert a slide about that. Do I want them to work on nature prescriptions? If so, I'll insert a slide on that. So personalize this to the ask you're making and the audience you're speaking to. Now, this is a training slide. So we all have, when you look at how docs and other scientists think change is made, it's often that we have an unconscious, so we don't know that we have this information deficit model of change making. So we think that if we're going to say, like, you should get a vaccine, unconsciously, we're super surprised and frustrated when people don't get a vaccine. And we all know that that's actually not how behavioral change works. So instead, moving to a target-based model of change making where you pick an iterative target strategically, you use tactics to get there, you tell stories that speak to people's hearts to motivate them, you win that thing, and then you pick your next target, and what you find is that every time you win, you build more resources. And meanwhile, sometimes you lose. And if you lose, it's really, really important to attend to that, because then it's a learning opportunity. So framing all of this as a learning loss, I'll have people come to me and say, hey, Courtney, we talked to the board at our university and they said, no, they're not going to divest. And I'm so mad. And I've left now. And I'm like, well, did you meet someone? And they say, yeah. I'm like, okay, so now you have a new relationship and you've built your social capital. And then they say, yeah, this one guy actually said that he'd help us build, with some money for posters that we could use to advertise it. Aha. So you've actually gained financial capital. So maybe you didn't get a win in terms of the ultimate decision you're looking for, but pretty much every time you make an attempt, you're likely to build up a certain amount of capital that you then have to increase your power to get the outcome the next time around. So thinking about this as iterative and thinking about how every time you have an interaction, you build team members, and all of that lets you move from a small level of achievements or a micro target to a meso community level or macro level target. This is based on Marshall Ganz's teaching. I asked him at the end of the course if it was representative. He said yes. He's acknowledged on the paper. I don't know of a better model, to be honest with you, so I'm just running with this one. If you find better models, please let me know. But I've taught across the world with this at this point for many years, actually, and it seems to work well for people. So this last one is sort of showing the potential of the health community to create change. So what is the potential of this group of trusted messengers that can really help control the allocation of a full 10% of global world product? So if we all start where most people start, you're a doctor, something crappy happens in your community, a wildfire, whatever, you're like, oh my God, what am I going to do? You're facing structural barriers to change, interpersonal barriers to change. You work on things at the micro level. People notice that builds actual real change in your community. That starts to change all of the norms. Your ripples of influence spread. You change then. People say, hey, I want to join your team. You do things at the hospital level. You do things at the macro level. All of that starts to change what decision makers are hearing, what the automobile industry is thinking about in terms of the timelines for EV change, what the pharmaceutical industries are doing in terms of decarbonizing their supply chain, what the energy industry, hedge fund people are saying, and it starts to shift subsidies, policies, and investments to make a rapid low carbon transition inevitable. So this is the potential of our health sector now. So I use this to show people how what we're doing in the hospital has ripples of influence that actually have the ability to fully tip the entire situation into a much, much healthier future. And this, there's evidence that if you think that your group is effective, you're more likely to join it. So this speaks to increasing a sense of group-based efficacy and increasing participation. So bon courage, that is a bird's eye view of my general approach, that this global group came up with. And I'm looking forward to now listening more to some of my panelists, because a lot of this approach is based on Maibach's research and some of the work of the other people on the panel. Thank you. Are you there?
Thank you, Courtney. Oh, thank you, Courtney.
Yeah, thanks.
That was great. We're going to move on now. Everyone, yes. We're going to move on, and I got to get out of the role of introducing people here. I am going to just introduce Lisa, and then hopefully you can move on together in the group. And Lisa Patel, who is the Executive Director of the Medical Society Consortium on Climate and Health, and works at Stanford, and is a world-class pediatrician who's going to tell you how to communicate.
World class, yes. Great. So I'm going to take the piece that Courtney was talking about, where we're really talking about how we get that conversation started with our patients in clinics and hospitals. Just a show of hands, how many of you have found a way to integrate climate change into your clinical conversations? I'm just curious. Okay, great. I'm actually a pediatric hospitalist. I'm not in the primary care field. And one of the things that I've heard from many of my primary care colleagues is that I don't have time. I don't know what to talk about. I don't feel like I'm competent in this issue to talk about it. So what I'm hoping is I'm just going to give you a little taste, and then I hope you'll join me in the workshop, because we'll have time to dive a little bit deeper into what clinical context you're working with your patients and where those opportunities might be. What I wanted to start with first is return back to the great Ed Maibach and a study that he did with Andrew Lewandowski. He's a pediatrician in Wisconsin. And what Ed and Andrew did, Andrew Lewandowski is a pediatrician in a clinic in Wisconsin where he was able to actually talk to about 100 families. He provided this statement to all of those families. In the last 2 years, the American Academy of Pediatrics and 100 other health organizations declared climate change a health emergency. Air pollution alone caused over 64,000 premature deaths in the United States in 2016, and worsening air quality is only 1 out of 9 ways that climate change is harming people, disproportionately harming children. So just like I want your children to eat healthy foods and be in the right car seat for their health and safety, we also know that decreasing our energy use, increasing energy efficiency, and supporting clean energy initiatives are also important for improving our children's health. Any questions? After he provided the statement, what he actually found was that there was not a single family that minded being read this information. And it actually opened the opportunity for conversations with patients to answer more of the questions that they might have had around climate change. So this is one technique for how you can bring up climate change in a context with sort of a set script that you can provide. The second opportunity, and this too, forgive me, I'm a pediatrician, and I think pediatricians have done a lot of work in this space, so I keep coming back to work of other great pediatricians like Dr. Rebecca Phillipsborn and her colleagues. So they did this really great paper on a pediatrician's guide to climate change-informed primary care. Now, back to this, barrier that we face that, you have 15 minutes, you have 20 minutes in a clinical encounter with the patient. Often you need to honor why the patient came to you, so you shouldn't be going in with your own agenda on what you want to talk about. You should be really receiving why your patient is there and using that as the basis for your conversation. And so Becca was very thoughtful in this piece. And what she basically talks about is for us as pediatricians, we have standard touch points with our families. We do standard screenings with our families, whether we're talking about food, whether we're talking about physical activity, whether we're talking about things like, can you pay for the energy bills? And so what they go through in this paper is you don't need to add new questions. What you should do is attach a climate lens to the questions that you're already asking. So if you're talking about food insecurity with your family, here's an opportunity to talk about maybe cutting meat consumption once a week as something that is both good for your health and good for planetary health as well. If you're talking about physical activity, you can talk about how active transportation is an opportunity to decrease your carbon footprint, but it's also an opportunity to get out and walk and be outdoors that we know is good for physical and mental health as well. So in this paper, they kind of go through those social determinants screen and show you how to attach a climate lens to each of those questions that you're already going to ask. Here's just some other, we're about to come out with this paper in BMJ about other possible touch points for counseling. So I work in a hospital working with mothers that are coming in, pregnant individuals who come in premature labor. And so often they will ask me, is it something that I did? Is it my fault? And I use that as an opportunity to actually talk about that there are a number of potential risk factors that it's not your fault. One of the risk factors, especially living in a place like California, are things like heat and wildfires, for example. There's opportunities in childhood preventative healthcare visits. And then for any of our mental health visits, particularly when we're talking about adolescents, there's an opportunity to talk about whether some of the anxiety can be driven by climate change. Basic principles that I think are important when you're talking to your patients about climate change is that I think if we can integrate these into existing tools, we are much more likely to use them. So if your clinic already has a social determinants of health screening tool, it's best to think about how you can integrate some of the questions into it. If you join me in the workshop, I'll show you there's an environmental screening tool that has been validated and used, and you can use some of those questions in a screening tool that you use if you don't have environmental questions in it right now. Consider chief complaints where it would make sense to integrate climate change counseling. So for me, for example, I integrate counseling about wildfires into every single one of my visits with asthmatics. I talk to all my parents with newborns about heat and the threats to newborns for heat. I talk to all my athletes that come in about the risks of heat stroke and heat illness. So think about chief complaints and how you can integrate it into those appropriate chief complaints. And then the biggest thing I also think for us to be mindful of is that we really need to consider equity implications when we're talking to our patients. So there is this very active discussion, and I hope that those of you who join me in the workshop, we can talk a little bit more about this. There are some people that think that we should be talking to all of our patients about carbon footprint. I actually sit on the side of thinking that those that have done the least to contribute, we shouldn't be talking about them decreasing their carbon footprint when we're talking about climate change. There are others that think that everybody should get that counseling, but I think it's important to think about equity and who has contributed the most when we think about what individuals can do to address climate change. The final resource that I want to share with you all, if you want to get some practice on how, and again, I'm sorry that this is so pediatrician focused, but we've developed the most and the best resources so far. This is the health effects of climate change that Becca Phillips-Bourne, Karina Maher, Shalini Shah, and Andrew Lewandowski helped to develop. It's a maintenance and certification 4 module. You can do it for free if you scan this QR code that's on Emory. And basically it kind of models what conversations you can have with your clinic, with your patients in a clinical setting. So the first half just talks you through the basics of climate change and health. And then the second actually models some climate conversations you can have. It's actually a quality improvement project. And so you do sort of a before and after where you get to practice what those conversations are in clinic, and I encourage y'all to check it out. And last plug is that our annual meeting is going to be in February. So if you want to learn more, do more, you didn't get enough from this conference, please join us in February.
So I'll do the story of self since Courtney suggested that we do that. I am Ed Maibach. I direct the Center for Climate Change Communication at George Mason University. I am a public health professional first, foremost, and always, and I am currently on my 42nd lap around the sun as a public health professional. So I've been doing this for a long time, for the past 16 years, exclusively focused on climate change. But what I want to, the thoughts I want to share with you is not about me, it's about us, the story of us. And that's a really important part, a really important extension of what Courtney talked about. Because we, health professionals, have what I consider to be a necessary and unique role to play in building both public will for climate solutions and perhaps more importantly, building political will for climate solutions. Because solutions at the individual level are helpful, but solutions at the public policy level are absolutely necessary. And I've never given a disclosure slide, not at least the way I'm giving it now. I have given presentations at medical conferences before where I've given a standard disclosure, conflict disclosure slide, but I've decided from now on out, anytime that I speak to our colleagues in the health community, this is what I'm going to disclose. Yeah, absolutely. I have all kinds of conflicts. I am all in on this. I have done everything I can for myself and my family to decarbonize our lives. We're not 100% divested because some of my 401k plan is controlled by a university that doesn't actually allow me to completely divest, but to the extent possible, we have done that. If you feel that compromises my judgment, if you feel that that creates a conflict of interest, so be it. That's my conflict. Here is the challenge and the opportunity that we face. We have served, my colleague at Yale, Tony Leiserowitz, and I, we've surveyed approximately 40,000 randomly selected Americans over the past 15 years. And before we ask them any other questions about global warming, we ask them a question: what's the first thing that comes to mind when you hear the words global warming? And this is the first thing that comes to mind for most Americans. What I summarize, not only polar bears, but polar bears is clearly the top of mind. So this single most common top of mind association. We get a lot of answers that deal with scientific topics. Maybe some people know the name of the Keeling curve, but they talk about science and scientists, which is all well and good, but science and scientists doesn't really reflect a personal engagement in the issue, just like unless you happen to live near where Courtney lives, up north of the Arctic Circle, polar bears aren't necessarily a personally relevant reference either. The third most common reference that we hear is reference to political figures or politics in general. And when we compare that to the comment to the person's known political party, it's always a comment about the other. It's so Republicans talk about Al Gore, Democrats talk about Mitch McConnell. These are never positive references. So it's a really negative connotation to be top of mind. This, my friends, this is the story of us. This is what we're going for. When the American people and when people in Canada and Europe and all around the world, when this is their top of mind association, they think about the health of their children, their own health, their loved ones, their friends, their neighbors, etc. That's when we know we've won, because our skin in the game, people's skin in the game, is quite literally their own skin. And our research shows that when they understand that, they are much more likely to be engaged in ways that build political will, the most necessary resource we need to build in order to bring about climate solutions. So another open-ended question that we asked, this is very recently published, last week, I think, we asked people, what do you think is the greatest, an open-ended question, okay? We're asking them in their own word, what is the greatest threat that global warming poses to the United States, if any? This top line, weather extremes and changes, that's actually a huge victory for my center. We have organized almost 1,100 TV weathercasters around America to educate members of their community that climate change is not just a distant threat, it's happening in our community already. It's changing our weather in ways that are not good for us. This is not something we would have seen 10 years ago. It is something we see in our data now. But look where health harms rank. This is actually something of a victory too, 3%, because trust me, 5 years ago, it would have been 0%. Not one person in the 40,000 has ever answered our question, what's the first thing that comes to mind, with any answer that would harken back to the health of someone that they care about. And this is our secret weapon. So James Hospitalis asked this morning, is there going to be a campaign on climate and health? Well, damn straight there is. And guess what? We are it. We are the forefront of that campaign. We are that campaign right now, and we are growing in size, in strength, and in effectiveness. And this is our secret weapon. Simple, clear messages, repeated often through our trusted and caring voices, okay? We are those people who have trusted and caring voices in communities across America and across the world. So this is from survey data in 120 countries from Ipsos, a polling company that I have a relationship with. They are asking not about trust in people, trust in experts on global warming. They're asking about, who do you trust? Who do you trust? Well, people in 120 countries trust doctors, nurses, and other health professionals more than any other type of professional. That is us, my friend. That is part of our secret weapon. In the Yale and George Mason surveys, this was data from a year ago, we asked, well, who do you trust? How much do you trust or distrust the following as a source of information about global warming? A much more specific question than Ipsos asks on its surveys. And I want you to look at the bars that I've highlighted in red, okay? That's primary care doctors. How much do people trust their primary care doctors as a source of information about global warming? Why primary care doctors? Because we figured most people have one. Not everybody does, but most do. And we know that they are able to, when we ask that question, that primary care doctor's face and her name, they come to mind. Those are concrete entities, unlike the American Medical Association, which we also ask about to sort of get at institutional trust, much more abstract level of trust in the health professions. And so on the left hand of the slide, that's all US voters. You see that primary care doctors are the fourth most trusted after NASA friends and family climate scientists. Not bad, but now go to the other side of the slide. Go to the right-hand slide. The very Americans whose minds are most closed on this issue are conservative Republican brothers and sisters. And when I say brothers and sisters, most of us have one, I do, whose minds are currently closed. Most Americans are worried. 7 out of 10 Americans are worried about global warming. They tend, very few of them happen to be conservative Republicans. The fact that conservative Republicans tell us that their primary care doctor is the person they trust most after friends and family, that's an extraordinary insight. That is an extraordinary opportunity that we have together. So in our research on trying to figure out how do we share what we know about the human health relevance of climate change, we've done a whole bunch of studies. I'm just going to go through them very quickly, and I'm going to summarize what we've learned because it's incredibly simple, but it's also incredibly important. So we started when we launched the Medical Society Consortium in 2017. We did messaging research prior to the launch. We essentially developed our very first publication, that Medical Alert, Climate Change is Harming Our Health report. And it was essentially a retelling of the 2018, no. When was the I'm totally drawing a blank. Oh, here we go. No, not on there. The National Climate Assessment's most prior report on the health impact of climate change in the US. Immediately prior to that, I've forgotten what year it was, maybe 2016. But we basically took the 8 key findings from the National Climate Assessment, the health impacts of climate change. For each of them, we wrote it in 150 words, give or take, simple, like I think 10th grade language is what we were going for. What's changing in our climate? How is that harming health? Whose health is most likely to be harmed? And so we had people read and respond to each of those essays, and both before and afterwards, we asked them a series of questions, and then we asked those questions again about 3 weeks later. What we learned is that reading those 8 short essays about the length of a news article, 1,500 words or so, we learned that reading that information increased people's engagement in the issue. It showed them the personal relevance of climate change. It worked both cognitively and affectively. They saw greater personal relevance and they became more worried about it. And it was especially, reading those 1,500 words was especially influential among moderate people in the middle of the continuum and people on the right-hand side of the political continuum. The second report that the Medical Society Consortium generated was on the other side of the coin. So there's the impacts and risk side, and then there's the benefits of taking climate action side. And it's a beautiful report. I encourage you all to download it and use it. But basically, it's the story of what we can do as a society to move forward with smarter policies that will benefit our health and will benefit our climate. And it's really just sort of 5 simple, clear ideas. Using clean, renewable energy and reducing the amount of energy we waste, favoring climate smart foods, farms, and food systems, favoring clean and active transportation options, improving our buildings and homes, and improving our community environments. And when we tested these, well, first of all, before we even tested the information about these health benefits of climate solutions, we pretty much knew that they were going to work, because unlike the climate benefits of these actions, which take decades to accrue and which accrue a little bit all over the world, and our colleagues in behavioral economics tell us that people don't like making investments in things that don't pay off until the future, and things that pay off for everybody else, or as opposed to primarily for us. So we were quite sure that telling the story of climate solutions, these 5 policy pathways that can give us better health and a more stable, safe climate, we knew they were going to work because they bring the benefits into the present, and they bring the benefits into our communities. So it slices through that Gordian knot that our colleagues who are pitching climate solutions for the benefit of climate solutions only. And sure enough, what we learned in the research that was published in the Journal of Climate Change and Health, mind you, thank you for that, Markley. We found that the most effective health narrative has 3 components, although I would bring in Courtney's component. Start with the story of self, why you care, but then do 3 more things. Talk about the health impacts of climate change, talk about the health benefits of climate solutions, and thirdly, affirm the fact that although very few people understand this, there is already a very strong social norm that Americans want to see climate action. Health messages that do those three things are incredibly effective, and they are even more effective among our conservative brothers and sisters than among our liberal or progressive brothers and sisters. Most recently, we have a paper coming out in Lancet Planetary Health any day now. We tested what I think is the fourth and necessary component of a climate and health narrative. If these things are so good, if these 5 policy pathways are so promising, why haven't we taken them? Well, the reason we haven't taken them is because fossil fuel CEOs and their lobbyists and the politicians in their back pockets are using incredible amounts of money and human capital to oppose them at every stage, at every step of the process, from Capitol Hill to your state capitol to your, literally, to community hall, wherever you live. They and their proxies are doing best to block these actions. And the beautiful thing about adding this fourth component into the climate and health narrative is it makes people even more likely to take political action. For us, the outcome in our research is people's willingness to take political action, to take their personal will and translate it into political will. And yet again, when we add in this calling out fossil fuel CEOs, their lobbyists, and the politicians in their back pockets, this is especially effective with our conservative brethren. So why is our role unique? Because we uniquely can make the problem personal. We uniquely can bring the solutions into benefits in people's communities right away. There is no need to wait. And we uniquely, perhaps uniquely, have the opportunity to depolarize this issue so that people, Americans and people in all countries, can start having adult conversations about what we want to do. So I invite you, if you are not already a member of the Medical Society Consortium on Climate and Health, we don't only have medical society members, we have individual members. Lisa and I are individual members. Many of you are too. If you don't happen to be one yet, please use your phone, activate this QR code. All we will ask you for is your name and your email address, and you too will be a member of the Medical Society Consortium, and you can use your trusted voices with ours to help us make fossil fuels history. Thank you.
And while she's switching, I'll start with my intro. I'm Beth Malow. I'm very honored to speak here today. Thank you so much for inviting me. I can't believe the 3 amazing speakers I'm following. I hope I can do some justice. I wish I had brought chocolate chip cookies though, especially since I'm going to lead in with political will. And I'm just gonna go ahead and jump to my. I want to cut. Oh yeah, the clicker. I want to. Oops. There we go. I'm just going to jump right to this slide to save us a little bit of time because I know we're running a little behind. I got interested in climate change because I'm interested in bridging political divides. I work with a group called Braver Angels. I was actually motivated by the COVID pandemic that was brought up earlier to become a student of science communication. And I'm taking coursework through the Alda Center for Communicating Science at Stony Brook. So I'm originally from New York, from Long Island, and I'm very happy to be back here and speak today. So political will, as Ed said, it is true that more Democrats believe that climate change is happening than Republicans, but it's still a majority of Republicans. It's in the 50s. It's a little low, but it is there if you want to focus on the positive. And I think that a really important thing to do in our society right now, not just for climate change, but for everything else that's going on, voting rights, anything, is trying to work to reduce polarization, effective polarization, political polarization, because we know that if we divide and silo the world into groups that are in group, my people, and out groups, them, it threatens our nation's ability to address challenges, including climate change. And we've seen that, right? Like this right now with the House of Representatives kind of being in a paralysis with speakers and various other things. So I'm going to advocate that diversity of ideas is important. I'm going to focus, though, on the idea of people who agree that climate change is happening, but they have different solutions. And this, as you like, I like the way you put it, Ed, our conservative brothers and sisters. I'm involved in a group called Braver Angels. It has a national goal of reducing political polarization, not just around climate, but around really any issue facing our world. And we try to go beyond stereotypes, and it brings liberals and conservatives together. I'm also very active in Citizens Climate Lobby, which is one of many different climate organizations that are all doing wonderful jobs. And I love this quote. This is what attracted me to CCL, the idea of trying to find common values and trying to figure out our own biases. And together we established a Braver Angels action team within Citizens Climate Lobby that works to reduce political polarization, works to bring the conservatives and liberals together in that organization. And one of the things I was really privileged to do was to create a workshop called Bridging the Divide on Climate Solutions, focused on reducing siloing and polarization, so that we can work together with our fellow Americans to kind of row in the same direction on climate change solutions. And I was really thrilled when the paper that I put together on designing and implementing this workshop was published in the Journal of Climate Change and Health. And I have a QR code if you want to pull the paper. It's open access. I just want to acknowledge my colleagues at Citizens Climate Lobby and Braver Angels who helped me with it. And the structure, and I'm going to be actually doing in the breakout, I'm going to be doing a 12-person in-person example, like a demo of some of the things we do in this workshop. We've done this workshop for 40 to 50 people online, and it's 2.5 hours in duration when you do the full workshop. We received feedback from multiple volunteers and staff within CCL, including conservatives and liberals. And we use basically prompts of characters who are liberal or conservative to take part in interactive activities, reflecting breakouts, group shares, role plays. And I want to just get back to what Courtney said earlier about really individualizing it to your audience. So when we speak to the Great Lakes people in Michigan and Minnesota, we talk about flooding. When we present to California audiences, we talk about fires. So we really try to personalize it. And our skill sets include listening, including identifying values, acknowledging, clarifying, a lot of active listening skills, as well as speaking skills and handling those challenging moments. Rita spoke earlier about storytelling. That's huge in what we do, teaching people their stories and how to tell their stories. And then these are just briefly our characters. We've got Lester, who's more liberal, and he's very worried about vulnerable populations and the urgency of solving climate change and the fossil fuel industries that we just heard about from Ed. And then Margaret is the conservative. We deliberately made the woman the conservative. I could talk more about that later and why we did that. And she's just worried about blowing up our economic system and wants to plant some trees and do carbon capture and more individual initiatives. And we work through how to respond to Lester and Margaret in your life. And again, I want to make the point that they both believe climate change is happening. They just have different solutions. So here's the results of what we did. We had 403 adults participate in our 8 workshops. It was a great time to do a workshop online because COVID was going on and a lot of people didn't have anything better to do. So it was really an amazing time. We had mostly women. We had 14% in healthcare or counseling. Unfortunately, this is a limitation. We mostly attracted white, liberal, and college grads, most with post-grad training. But still, it was a start, and we were very happy about people's ability to tell us they could listen to others in a way that they felt heard, they participated, they felt like they could set constructive tones when starting conversations with people about climate change. And these were some of the comments we got. I love this. What was the most important thing you learned? The importance of respecting others, curiosity, openness, and then not to launch into a lecture, really trying to understand where people are coming from, practicing. And even though we're all feeling this urgency to address climate change, being patient, being respectful, walking away when it looks like you're not going to make progress, try again the next day. Those are some of the key comments. So in summary, we developed, we pilot tested, we implemented this workshop, and we did it during COVID, and we found that participants were quite engaged. They gained a lot of confidence in how to be a constructive speaker in conversation, to listen in a way that the other person felt that they were heard. And we hope in future work to get involved, have more diverse participants, not just socioeconomically, but racially and politically as well, and really try to determine the direct effects of our workshop on partisan, political, effective polarization. Thank you very much.